Hello. In this tutorial, we're going to visualize the morphologic cardiopathies on ECG interpretation. Morphologic cardiopathies on ECG interpretation. Now, for the morphologic cardiopathies on ECG interpretation, we are going to visualize particularly left atrial enlargement, right atrial enlargement, right ventricular enlargement, and left ventricular enlargement. Now, we need to know that left atrial enlargement, right atrial enlargement, they are signs particularly, these dilations particularly show that the patient may have heart failure. Particularly left atrial enlargement may show a heart failure, or it may show also hemodynamic abnormalities, and particular hemodynamic abnormalities that you may have are valvular heart disease. You can have a left atrial enlargement in case of a mitral regurgitation that you can visualize physically, and other pathologies. You can have also a right atrial enlargement in case of a tricuspid regurgitation. You can have a right ventricular. In case of a right ventricular enlargement, you have particular right ventricular hypertrophy. You can have right ventricular hypertrophy in a case where you have a pulmonary stenosis, or you have a pulmonary arterial hypertension, is it clear? Or you have even a pulmonary embolism is going to be showing as well. A chronic pulmonary embolism is going to show as a right ventricular hypertrophy. And also you can have also a pulmonary stenosis associated with a case of a congenital heart disease in a pathology of Fallon, still in a right ventricular hypertrophy. Lastly, you have left ventricular hypertrophy that may show left ventricular hypertrophy that may show an aortic stenosis. Is it clear? You can have a left ventricular hypertrophy. You may have also a systemic pulmonary hypertension may be shown in the case of a left ventricular hypertrophy, or you may have also an aortic regurgitation that may show a sign of left ventricular hypertrophy. In this case, it's a paradoxical left ventricular dilation and not hypertrophy, but similarly they're going to have those same signs. Is it clear? So generally, this is the introduction of the different morphologic cardiopathies. Now, we are going to start with the atrial enlargement. Now, for the atrial enlargement, you need to know that you have two major atrial enlargement. You have left atrial enlargement and you have right atrial enlargement. So those are the two major atrial enlargement that you have. You have left atrial enlargement and you have right atrial enlargement. Now you need to know that the atrium is going to be visualized at the level of the P wave, and then the general leads, the best leads that you can visualize the P wave is the limb lead 2 and limb lead V1. Is it clear? Now in limb lead 2, generally the P wave is as such. Is it clear? If you visualize a tall P wave on limb lead 2, is generally a sign of a right atrial enlargement. Is it clear? When you visualize a tall P wave, I said P wave. When you visualize a tall P wave on limb lead 2, it's a sign of right atrial enlargement. Now, if you visualize a bifid P wave, is it clear? If you visualize a bifid P wave on limb lead 2, it is also another sign of right atrial enlargement. Is it clear? It's a sign of of a left atrial enlargement. So when you have a bifid P wave on limb lead 2, it's a sign of left atrial enlargement. Now, there is a question. There are times that you visualize bifid P wave in an atrial extrasystole and in a case of a left atrial enlargement. Now, how can you distinguish a P wave, a bifid P wave of an atrial extrasystole and that of a left atrial enlargement? Now, in atrial extrasystole, the bifid P wave is going to be diffuse. It's going to be on all the leads. Why, in a case of a left atrial enlargement, the bifid P wave generally just occur at the level of the limb lead 2. If you have just a bifid P wave on limb lead 2, you think of a left atrial enlargement. And if it is diffuse, you think of an atrial extrasystole, which occurs among the arrhythmia pathologies. Now, the next thing is to visualize right and left atrial enlargement based on the V1 lead, chest lead. Now, when you move now on the V1 chest lead, you have to know that what you have a positive side and you have a negative side on the V1 chest lead. Is it clear? Now, if this positive side is enlarged, is it clear? If you have an increase in amplitude of a positive side more than half a B square, it shows a right atrial enlargement. Is it clear? Right atrial enlargement, and an increase in this positive wave is called what is called P pulmonale. Is it clear? A P pulmonale. Is it clear? When you have an increase in the positive side, P pulmonale. Is it clear? Now, if you have an increase in the negative side, if you have an increase in positive side, you call P pulmonary, representing right atrial enlargement. If you have an increase in negative side, it corresponds to a P mitrale. Is it clear? And P mitrale corresponds to a left atrial enlargement. Is it clear? Now, after the atrial enlargement, we have the ventricular enlargement, particularly called ventricular hypertrophies. Now, let's start with right ventricular hypertrophy. Is it clear? Now, to visualize right ventricular hypertrophy, generally we use lead V1 and lead V2. Is it clear? Normally, we need to know that what the R wave of lead V1 and V2 are less than the S wave amplitude. The amplitude of the R wave is going to be less than the amplitude of the S wave on the V1 and V2 chest leads. Is it clear? Now, if the R wave is instead greater than the S wave, is it clear? Generally, that is a sign of a right ventricular hypertrophy. Or another sign of right ventricular hypertrophy is if the R wave is greater than 7 millimeters. Is it clear? If the R wave is greater than 7 millimeters, or this can also be changed mathematically to R all over the S ratio being greater than 1, because if I just divide here by S, I divide by S, I have greater than 1. So if you have the R all over the S ratio of greater than 1, it also corresponds to right ventricular hypertrophy. Now, when you have right ventricular hypertrophy, normally we have already seen when on the part of the tutorial of the axis deviation that the normal axis deviation should move is when the vector plane direction, the resultant vector amplitude or resultant vector impulse move toward the apex of the heart. Now, in the case of a right ventricular, if let's say there's a right ventricular hypertrophy, is it clear? It means that the amplitude, the general impulse direction is going to shift towards this direction. Is it clear? And when there is a shift towards this direction, that is why in right ventricular hypertrophy we have also a right axis deviation. So another sign of right ventricular hypertrophy is a right axis deviation that we have already visualized. Is it clear? And lastly, the last signs of right ventricular hypertrophy is that in the normal progression, we have seen the normal progression of the leads. Is it clear? Is it clear? From the V1 to V6, and we said that V1 is going to have the R wave amplitude is less. V1 and V2 have the R wave amplitude less than the V2, less than the S wave amplitude. The V3 and the V4 have the R wave amplitude approximately equals to the S wave amplitude, and the V5 and the V6 have the R wave amplitude greater than the S wave amplitude. Now, in a case where you have instead an inversion, where at the level of the V1, V2, you instead have the R wave which are greater than the S wave, V2, V3, it is not that normal transition. It can also be a sign of the right ventricular hypertrophy. Now, lastly, we are now going to move up to the sign of left ventricular hypertrophy. In the sign of left ventricular hypertrophy, we have what is called the Sokolow-Lyon index, and we have what is called the Cornell's criteria. Basically. Now, what we are going to see here is going to be the Sokolow-Lyon index. This other one is going to be sent through comments. Now, the Sokolow-Lyon index states that what? The S wave or the chest lead V1 plus the R wave of the chest lead V5 or V6 being greater than 35 millimeter in men and greater than or equal to 30 millimeters in women corresponds to a left ventricular hypertrophy. But generally, just put in mind 35 millimeters. Is it clear? But it has to be normally in men and women. But just put in mind 35 millimeter. That's the best response. Now, what you have to do is that generally V1 is located here. So you go there, you visualize this is the P wave, this is the QRS complex. So this is the S wave and this is the R wave, let's say like that. And then you have the T wave. You have now to go on V5 or V6. You measure the tallest amplitude, either of V5 or V6. So you have this. Is it clear? And you have also this, you can have also this. Generally they intertwine. Is it clear? So you take, when you have this type of ECG like that, on the different parts of the ECG, you come and take, when you see the amplitude of V6 being taller than amplitude of V5, you better take V6 to measure the sacral ion index. But if the V5 was greater than the amplitude of the R wave of the V5 was greater than the V6, you take the V6, you take the V5, sorry. So you take this amplitude, so you measure the number of big squares, you measure the number of small squares, sorry, or the number of big squares. It depends on you. So you measure the number of small squares or the number of big squares in order to have the amplitude. And similarly, you measure the number of big squares and small squares to have the amplitude here. Why knowing that one small square corresponds to 1 millimeter. So when you measure the number of small squares, you are going to have the number of 1 millimeters. But if you measure the number of big squares, you are going to have the number of 5 millimeters. So let's say that this S wave was equal to 10 small squares. If it was 10 small squares, it's going to correspond to 10 millimeters. Are you seeing? And if it is 2 big squares, it's going to correspond to still 10 millimeters, because 1 big square is 5 millimeters. Similarly, this R wave, let's say that is corresponding to 15 small squares. 15 small squares is going to say, let's say that is correspond to 30 small squares. 30 small squares is going to correspond to 30 millimeters. So you do 10 plus 30, that is going to be 40 millimeters, and that is greater than or equal to 35. So it's going to be positive sacral ion index. That shows the left ventricular hypertrophy. The next one is going to be the corneal criteria that they're going to see at the level of the comments. Is it clear? So those are the different criteria to visualize the left ventricular hypertrophy. Now the next element that shows you left ventricular hypertrophy is that, similarly, on this diagram here, we say that the apex of the height is a major site where you have the impulse, the electric impulse in a normal heart. But in the case of a left ventricular hypertrophy, here is going to be hypertrophied. So there is going to be a slight shift from the apex toward the left side. So you are going to have a left axis deviation, and the particular left axis deviation that you have in left ventricular hypertrophy is going to be a pathologic left axis deviation that we have already seen initially. Is it clear? Now, the next tutorial that we're going to see is on the conductivity disorders. So from here we say thanks for your kind attention. Please don't forget to like and subscribe to our channel. Thank you.